Welcome everyone. I'm Kamila Orzechowska and I'm a final year student at Coventry University, and also I'm a research intern with Renal Patient Support Group. And in this presentation, the title of this presentation is Chronic Liver Disease in Context of Polycystic Kidney Disease. During this presentation, I'm going to introduce vital information about chronic liver disease and impact of diabetes on various stages of CLD. Also, I'm going to talk about the relevance of chronic liver disease to polycystic kidney disease. In this context, I'm going to introduce autosomal dominant polycystic liver disease and key information about this. Next, I'm going to talk a little bit about health-related quality of life, introduce some physiological impact of chronic liver disease, influence of diet and on development and progression of chronic liver disease, the importance of early intervention, and also I'm going to speak a little bit about liver screening, invasive and non-invasive, which invasive is biopsy. And also I'm going to speak finally about principles and value in health promotion. Chronic liver disease is characterized as deterioration of liver function for more than 6 months, caused by repeated insult of liver, which can result in inflammation, fibrosis, and cirrhosis. CLD is recognized as a public health issue worldwide. WHO estimates a total of 180 million people worldwide are infected with hepatitis C virus and are at risk of development cirrhosis and liver cancer. In UK, is observed increase in liver disease over the last 4 decades. Increased occurrence of liver disease can arise due to a wide range of pathogenic, which include alcohol consumption, viral infection, inherited aspect, vascular and medical etiology. In this slide, I introduce information about impact of diabetes on various stages of chronic liver disease, the adverse effect of CLD impact lifestyle and change in lifestyle health, establish a person's well-being. Diabetes is an issue affecting severity of chronic liver disease and is estimated in 20 to 30% of adult patients with non-alcoholic fatty liver disease, which also suffer from type 2 diabetes. Diabetes increases risk of fatty liver by 2.5 folds in adults with normal liver, and decrease overall survival by 40% in 5 years in patients with end-stage liver disease. Cirrhosis is also called, is identified as end-stage liver disease. At this slide, I'm going to introduce the connection between polycystic kidney disease and polycystic liver disease. So autosomal dominant polycystic kidney disease or autosomal recessive polycystic kidney disease occur in combination with autosomal dominant polycystic liver disease. And ADPLD is characterized by cyst manifestation, mostly in the liver with or very few in the kidneys. Cyst development does not affect total liver volume. The figure of this slide illustrates the disease progression. The number and size of cysts increase, but the size of liver, the total liver volume, doesn't change. Frequently observed risk factor for development and enlargement of liver cysts in PKD are attributed in female gender, history of pregnancy, larger renal cyst size, and elevated estrogen hormone levels in patients with renal insufficiency. Liver involvement in PKD is the most frequent manifestation in autosomal dominant form of PKD, affecting approximately 80% of patients and remain responsible for hepatic complication. The prevalence of liver cysts increase with age and develop later than renal cysts in autosomal dominant polycystic kidney disease. Also, hormonal environment strongly influence liver cyst development, and this was investigated by several studies that estrogen stimulate hepatic cyst formation. I introduced this slide to just highlight the influence of non-alcoholic fatty liver disease on kidney functionality. Non-alcoholic fatty liver disease increase in 41% increase risk of development chronic kidney disease stage 3 and 5. This figure showed that Western diet, which is mostly high in red meat, pre-packed food, butter, candy, and sweet. So very unhealthy diet. Also type 2 diabetes, insulin resistant, and sedentary lifestyle. Increased fat accumulation in liver and development of fatty liver. If the lifestyle and early intervention is not introduced, the disease progress and is observed inflammation and scarring of liver, what progress to cirrhosis and lastly carcinoma. Health-related quality of life is a vital outcome measurement in medical care. Patients with chronic liver and kidney disease have shown impaired health-related quality of life. It was investigated in several studies that total liver volume and total kidney volume displayed a significant negative correlation with age-corrected health-related quality of life in autosomal dominant polycystic kidney disease patient. And also lack of treatment in polycystic liver disease and polycystic kidney disease other than transplantation is linked with stress and decrease of health-related quality of life. The presence of PKD complication is associated with decline in health-related quality of life and self-esteem. The educational programs are associated with improvement of and empowerment patient to feel more capable of impacting health outcomes. In this slide, I introduced some of the physiological impact of chronic liver disease. In humans, nearly 70% of overweight subjects are up to 90% of obese people with developed fatty liver, leading to accepted view that the main risk factor for fatty liver development is overweight status or obesity. However, non-alcoholic steatohepatitis was initially described as developing via two-hit model hypothesis, which include a first step or hepatic fat accumulation followed by liver injury and oxidative stress. Defective insulin signaling, such as insulin resistant and type 2 diabetes, as well as genetic and environment factors, are some of the determinants in the transition from asymptomatic status towards severe disease. Also, stress response causes pathological conditions through multiple systems, including the adrenocortical and sympathetic nervous system. Stress is recognized as a factor of worsening clinical symptoms and hepatic biochemistry in patients with chronic liver disease. The nervous activation and decrease in hepatic blood flow led can lead to hypoxia and finally causing liver damage. Also, stress is associated with elevated liver enzyme. Bacteria infection also play the vital role here and are associated with development of cirrhosis. Screening and treatment for infection is one of the main therapy principles to overcome disease progression. Variceal bleeding is life-threatening and can cause hypertension, complication affecting 30% of chronic liver disease patients. Diet and lifestyle can have influence on development of liver disease. Carbohydrate and daily fat intake put us at the risk of liver cirrhosis. It was observed that carbohydrate can present a fatty liver without having to consume large amount of alcoholic drinks. Also aflatoxin, which are carcinogens and mutagens that are produced by certain fungus. It was observed that aflatoxins are in food such as corn, cassava, peanuts, rice, and wheat are contaminated with aflatoxin. Also, it was reported that aflatoxin can cause liver toxicity and failure. Lower dietary intake will decrease the risk of chronic liver disease. Enlarged liver utilises a mass effect on the nearby area of GI tract, causing gastrointestinal symptoms and disturbing nutritional status of ADPKD patient. Total kidney and liver volume is a significant predictor of malnutrition and the nutritional problem of ADPKD patient. And this image, this figure illustrates that high fat diet can turn healthy liver into fatty liver by triglyceride hepatic accumulation. And if the bad dietary habit will continue even with diagnosis of fatty liver, this can occur hepatic injury and inflammation and progression of disease. Early intervention is essential and vital point to prevent chronic liver disease progression. Health assessment should be introduced in health risk patients and please attempt to improve CLD. In the case of ADPKD and ADPLD, the genetic consulting should be implemented in order to hide inheritance pattern, which is equal to 50%. Also, molecular diagnostic help establish an appropriate diagnosis and disease management. Cirrhosis usually develops over many years and present late. This means cirrhosis could be prevented through early detection and treatment. In fact, it's estimated that over 90% of liver disease is preventable. This figure ideally shows why early intervention is so important. When the liver disease progresses to fatty liver or no alcoholic steatohepatitis, the disease progression can be stopped and the effects of liver disease can be reversible by early diagnosis, healthy lifestyle, control of diet and calorie intake. However, if patient progress to cirrhosis to end-stage liver disease, the disease is irreversible and is observed irreversible liver remodeling. Liver screening can be non-invasive or invasive such as liver biopsy, which I'm going to talk about in next slide. This table shows a non-invasive screening option. A non-invasive liver screen refers to screening question, biochemical tests, and imaging to assess patients with suspected liver disease. is employed when blood tests show abnormal liver function or chronic liver disease is suggested from clinical examination or imaging. And international clinical practice guidelines now recommend that screening for fatty liver should be part of routine workup in patients with type 2 diabetes, obesity, and metabolic syndromes. Liver biopsy is invasive screening and is a gold standard diagnosis method for identification of cirrhosis. Liver biopsy allows for identification of fat accumulation, inflammation, and scar tissues. In cirrhosis, the scar tissue replaces liver cells. The figure at the bottom shows the difference between normal liver and cirrhosis of the liver tissues. These figures show how precipitating, how several events such as excessive alcohol intake, viral infection, liver surgery can contribute to systemic disease development over time. The mentioned before can contribute to development of acute or chronic liver failure. Cirrhosis is associated with significant morbidity and mortality from a number of complex interlinked complications, which include organ or system dysfunctions. Principle and value in health promotion. The UK Liver Advisory Group has formed a panel to review the management of chronic liver disease and attempt promotion campaign in health promotion. Long-term exercise has been observed as a beneficial in polycystic liver disease and fatty liver. Moderate intensity aerobic exercise was observed to improve exercise capacity in patients with liver cirrhosis. Long-term exercise can improve exercise capacity prognosis and self-esteem in chronic liver disease and chronic kidney disease patients. Aerobic and resistant exercise show great influence on health improvement. In summary, the use of effective screening and treatment in early stage of liver disease appears significant in reduction the worsening of patient health. Change in lifestyle and dietary control could stabilize the condition. The current prognosis in understanding hepatitis pathophysiology has a significant influence on identification promising drugs, which could help with polycystic liver disease management. The management of patient lifestyle and introducing self-care program and empowering patients have positive influence on health-related quality of life. Also, data suggests that there is a need for broader collaborative effort, especially where patient and professional care work together to inform best practice through health promotion and management of chronic liver disease and polycystic kidney disease. Also, there is a need to develop a strategy for early diagnosis and management of disease and development to novel therapies. Here is this list is introducing some of the journal article which I use in during developing this presentation, and I highly recommend you for go through some of these if you are interested in this topic. Thank you for your attention and for your time. Hopefully you enjoyed the presentation and it was very informative for you. If you have any questions, I'm happy to answer, and at the slide you can see my email, address email. Thank you.